Welcome to Therapist Starter Pack, a podcast for those who are just getting started in the field of mental health therapy. I'm Autumn, and I'll be your host today. Today, we'll be discussing clinical supervision, what it is, and how to get the most of it. Stay tuned. Many have compared the supervisor-supervisee relationship as similar to the therapeutic alliance. However, there are also added expectations, complications, and benefits of being colleagues and in an educational relationship. Supervision also varies widely by supervisor and the needs of the supervisee. Milne defined clinical supervision as follows, quote, "The formal provision by appointed supervisors of an intensive relationship-based education and training that is work-focused and which manages, supports, develops, and evaluates the work of colleagues." End quote. So essentially, clinical supervision is the process of working with a supervisor towards supervisee, competence, and development. Development toward what, though? SAMHSA listed some counselor development criteria in their Training Improvement Protocol 52. They defined 3 levels of counselor development. Pay close attention and see where you would place yourself. There's level 1 where the counselor focuses on themselves, is anxious, is preoccupied with performing the right way. They might be overconfident or overgeneralized. They might overuse a skill. There might be a gap between their conceptualization, goals, and interventions, and they might have underdeveloped ethics. In level 2, a therapist focuses less on themselves and more on the client. They might be confused or frustrated with the complexity of counseling. They might over-identify with the client and lack integration with their theoretical base. They might feel overburdened, but they also better understand ethics. Level 3 is defined by a focus intently on the client, a high degree of empathic skill, objective third-person perspective, integrated thinking and approach, and signs of being a highly responsible and ethical counselor. The goal of supervision is to help you through these stages of development. Now, there's a lot of literature on how to be a supervisor and not as much on being a supervisee. This is theoretically because the supervisor is supposed to facilitate the process. However, you typically get out of supervision what you put into it. And so today we're going to talk about how to get the most out of supervision by putting the most of yourself into it. The website Good Therapy has some suggestions for how to get the most out of supervision. They include being proactive, bringing specific questions and issues to your meetings, and trying not to get defensive in response to feedback. The APA Board of Educational Affairs published guidelines for clinical supervision and health service psychology. There are 7 domains aimed at the supervisor, but these are also useful for the supervisee to know about. The first domain is supervisor competence. The second domain is diversity. And in this domain, supervisees should work towards competence in understanding and addressing diversity of oppression, privilege, and power. The third domain is supervisory relationship, which they define as a collaborative relationship. So the supervisee needs to work with their supervisor as much as possible to be able to have a collaborative relationship. The fourth domain is professionalism, where you learn how to work with integrity, accountability, and concern for the welfare of others while developing your professional identity. The fifth domain is assessment, evaluation, and feedback. In this domain, it's helpful to know how you will be assessed and evaluated as a supervisee so that you can work towards goals together. The sixth domain is problems of professional competence. In this domain, supervisees should try to communicate about concerns you're having, preferably before they become a bigger issue. I know that when you're learning, there's a temptation to try to appear perfect. I assure you, you will learn much more by talking about your concerns and your mistakes than by trying to appear perfect and to sweep your concerns under the rug, especially if those concerns might grow to become bigger problems. Which brings us to the final domain, ethical, legal, and regulatory considerations. Use supervision as a chance to learn ethical and legal requirements of the job that you will be expected to uphold during your profession. We get more advice from Pearson in 2004. They recommend being proactive and flexible, asking for what you need but not demanding it, taking responsibility for learning and growing in supervision, continuing to do self-assessment and reflection towards your own growth, avoiding blame and focusing on planning and problem solving, and asking yourself what you can learn from your supervisor, even if they do not provide everything you were hoping for. Falender and Shafranske also had some suggestions. They said to develop goals and tasks to achieve competence, to construct a supervision contract providing informed consent about expectations, roles, and responsibilities for everyone, and to reflect on biases, attitudes, and worldviews. I might add a few more tips to these. Write things down as they come up during the week and after each client session, to be persistent but professional, and to ask for feedback. It can be hard to ask for feedback sometimes, and often those are the times where you need it the most. Peter Casciaroli, LMFT, in that Good Therapy article said, "Notice what you don't want to bring to supervision and find out why. Then, bring it to supervision." Okay, let's wrap up. Clinical supervision is a process of working with a supervisor towards supervisee competence and development. You get out of supervision what you put into it. Now, we talked about a lot of different ideas today, but you know me, I like my acronyms and initialisms, so here are the ABCs of supervision. Assess yourself, be proactive, and clarify roles. By assessing yourself, I mean know where you want to go and try to determine your progress. Then, ask for feedback on your assessment and how to achieve your goals. It's important to be able to assess yourself and where you're at, but your supervisor may have a different perspective than you and may be able to help you flesh out that understanding of yourself. Be proactive means putting in the work before and after supervision, persistently but professionally asking for what you need, and being prepared with specific questions and issues to bring up during supervision meetings. And finally, clarifying roles means knowing what's expected of you and what you can ask for from your supervisor. So ABC, assess yourself, be proactive, clarify roles. Remember your ABCs and do your best to get the most out of your supervision. And that's all for today. All sources will be in the show notes and at therapiststarterpack.net. You can find links there to subscribe to the show and leave a review on Apple Podcasts, which would be a huge help to the show. And until next time, remember, everybody starts somewhere.